Often grouped under the term arthritis, rheumatic diseases are a group of autoimmune or inflammatory diseases that cause the immune system to attack joints, tendons, and muscles. Rheumatism, which manifests itself as muscle pain, swelling, deformity, and symptoms that prevent movement, and rheumatism, which includes types such as rheumatoid arthritis and osteoarthritis, which are considered risky in themselves, are generally caused by genetics, age, environmental factors, and obesity. Although it is not possible to completely eliminate rheumatism, it can be controlled with medications. Since rheumatism that is under control may flare up suddenly, constant medical follow-up is essential even if there are no complaints. Rheumatism is a musculoskeletal system disorder that affects one or more structures such as tendons, muscles, ligaments, bones, and joints, causing pain and limitation of movement. The most dangerous type of rheumatism is rheumatoid arthritis, which is a disease that is seen at almost all ages and can cause various disorders in the defense mechanism. It is considered rheumatism, which usually occurs with pain, swelling, and limitation of movement, occurs as a result of reasons such as genetics, age, gender, environmental factors, and obesity. Rheumatism causes more pain in overweight people, manifests itself with swelling, warmth, and pain in the joints, and if left untreated, can cause serious discomfort and complications. Rheumatism, which occurs as a result of the destruction and wear of muscles, tendons, ligaments, and multiple structures, generally occurs due to reasons such as genetic transmission, age, gender, environmental factors, and obesity, and can be seen at almost any age. Causes of rheumatism can be evaluated in two different contexts: inflammatory and non-inflammatory rheumatism. In rheumatoid arthritis, also known as inflammatory rheumatism, the immune system attacks healthy tissues. In non-inflammatory rheumatism, the situation is slightly different. Non-inflammatory rheumatism usually involves age, gender, and weight conditions along with genetic transmission. At the same time, some rheumatism affects not only the joints but also the immune system and internal organs. Although there is no definitive treatment for rheumatism, the severity and symptoms of which can be alleviated with drug treatments applied in recent years, patients can live a more comfortable life. Generally, the causes of rheumatism are genetics, age, gender, environmental factors, obesity, heavy sports, impacts and injuries, wear and tear of joints and tissues, stress, lifestyle, metabolic problems. Rheumatic diseases are divided into types. The most dangerous rheumatic disease among these types is considered rheumatoid arthritis. Rheumatoid arthritis is an inflammatory condition that occurs when the immune system mistakenly attacks healthy tissues. Apart from rheumatoid arthritis, osteoarthritis, and ankylosing spondylitis are also rheumatic diseases. Rheumatoid arthritis. Considered the most dangerous rheumatic disease, rheumatoid arthritis occurs when the immune system attacks the body's own tissues and symptoms such as pain, swelling, and stiffness are experienced. Osteoarthritis. Osteoarthritis, caused by damage to the cartilage, the soft material at the ends of your bones, causes joints to become painful and difficult to move as the bones wear down. It usually affects the knees, hips, lower back, neck, fingers, and feet. Ankylosing spondylitis. Ankylosing spondylitis, popularly known as lumbar rheumatism, is a disorder that occurs as a result of inflammation in the spinal bones. Lupus. Lupus, an autoimmune disease also called systemic lupus erythematosus, is also considered among rheumatic diseases. Common symptoms of rheumatism include pain, redness, swelling, and stiffness in more than one joint, tenderness with muscle stiffness that occurs in the morning or while sitting, fever, fatigue, and limitation of movement. Common rheumatism symptoms include pain, redness, swelling, and stiffness felt in more than one joint. Pain, especially in the knees, ankles, elbows, and wrists. Chest pain and shortness of breath. Low back pain radiating to the spine. Joint stiffness lasting at least 1 hour, especially in the morning. Sensitivity to the sun. Fire, chronic fatigue and low energy. Hair loss. Pain and stiffness in the back when resting and standing up. Difficulty and stiffness while moving. Deterioration of kidney functions. Decreased appetite and weight loss. Irritation and burning in the eyes. Dry mouth. Gland formation. Changes in fingernails and toenails. Debris, pain, redness, swelling and stiffness. Pain, redness, swelling and stiffness occur in the bones as a result of the destruction, and wear in the tissues and muscles as a result of rheumatism disease. Joint stiffness lasting at least 1 hour, especially in the morning. Joint stiffness caused by inactivity when waking up in the morning is among the common symptoms of rheumatism. Pain and tenderness that occurs while sitting. Pain and tenderness may occur as a result of the bones rubbing against each other while sitting. Fire, rheumatism, a group of inflammatory diseases, causes fever caused by infection in the body. Fatigue and low energy. People with rheumatism typically have more than one persistently inflamed joint. Inflammation in the body can lead to overall physical weakness, lethargy, and fatigue. Difficulty and stiffness while moving. Destruction of muscles causes the person's bones to strain and experience stiffness while moving. Deterioration in kidney functions. Especially people with rheumatoid arthritis may experience an inflammation of the tiny filters in the kidneys known as glomerulonephritis. Decreased appetite and weight loss. Pro-inflammatory cytokines such as TNF, which damage joint tissue in people with rheumatoid arthritis, can also lead to weight loss, muscle wasting, and muscle weakness.